Good morning, everybody. Welcome to the webinar. My name is Zach Mazer. I am part of the Police Federation of England and Wales. I'm part of the Men's Health exec team. I've got a colleague who's with me today who will be helping and monitoring questions. Please engage. We want as much virtual engagement as possible. Webinar is really important. Men's health is really important. We're in testicular cancer month, and we felt it was important that we were able to do that. And as we're aware, the webinar is called Know Your Balls. We've got a really busy agenda. We've got some fantastic speakers. Our first speaker is Professor John Harrison, who is Chief Medical Officer for the Police Service of England and Wales, a very good friend of the Police Federation, and has been helping us with men's health. So good morning, John. Thank you very much for joining us.
Good morning, everybody, and thank you very much for inviting me to start this very important meeting. Can you hear me okay? Can you hear me?
Yes. Yep, can all hear you fine.
So it's just that, anyway, I'll carry on. As I say, a very important meeting. I think, as will become clear, and maybe I'm already speaking to the converted here, but men are not very good at talking about their health generally, and they're not particularly good, I think, at talking about the more sensitive issues. And compared to women, I think we've got a lot to learn here, and I think today is an important step forward in helping us do that. I've been asked to talk about testicular self-examination, and I think this highlights one of the problems that we have in addressing something which is really challenging, I think, to men. Clearly, it's a part of the anatomy which we don't tend to focus on very often. It's related, obviously, to sexual activity. It relates to our image of ourselves as men, and perhaps for those reasons we find it difficult to share conversations about this. Contrast that with women, of course, who are very good at doing breast self-examination. They're very good at making sure they have cervical smears. So hopefully we can learn from that and move forward. And I've got really three important takeaway messages for today. First is that testicular self-examination only takes a minute. It can be done very quickly, and importantly, it can help you detect abnormalities, and it might save your life. Being aware of our anatomy is really important because we want to detect early signs of change, which might actually be dangerous to us, and that will then encourage us to go and seek help, go and see your GP. Because testicular cancer, although it's not a common cancer in men, can occur at most ages. In fact, it can occur at all ages, but certainly post-puberty. It can occur at all ages, and it's particularly common, given that it's an uncommon cancer, in the earlier years. And if we can pick it up early, the response rates to treatment are fantastically good, and the survival rate from treatment is excellent. So for most people up to about the age of 60, if we pick it up early in what we call stage 1, where tumours are confined to the testis, with appropriate treatment, response rates over about a 10-year period are in excess of 90%. And the good news is that survival rates have gone up over the last decade, last 20 years, 10 to 20 years, significantly. As I say, most tumours will present at what we call stage 1, which means they're confined to the testis. So we need to be aware of possible subtle changes that might occur in our anatomy. I think it's also important to note that in most cases, the changes will be painless. So unless you are familiar with your anatomy, it may be that you will not detect changes until it is getting rather late. The sort of treatments that are available usually involve surgery, possibly removal of the testis. It's completely, or in some cases, partial surgery on the testis to remove the tumour, and chemotherapy may well be offered as well. That's the surgery plus or minus chemotherapy, the two commonest patterns of treatment. Clearly, there are side effects associated with chemotherapy. It can be done on an outpatient basis. It's a needle into the arm, running treatment in through a drip. Side effects can be significant. So again, people might be worried about that. But actually, if you can get through it, as I say, the response rates are absolutely excellent. And so this can save your life. So what do we need to do? There's lots of information out there already. So all I'm really doing is signposting you to some excellent resources. If you haven't found them already, a couple of signposts. Testicular Cancer UK. If you go to their website, how to check your testicles, there's a good video there. Baggy Trousers, Let's Check Your Nuts is worth a look as well. And if you want something a little bit more medical stroke academic, the British Association of Urological Surgeons, or BAUS, have a very good FAQs section on self-examination, and that is regarded as best practice within the UK. So what is it you need to do? I think, first of all, get into the habit of doing this on a regular basis. And people recommend that you do this maybe about once a month. Second, do it link it in with something like a warm shower or a warm bath, so you're nice and relaxed. And get yourself into a nice sort of comfortable position. It's important. The relaxation is important because if you look at the anatomy of the scrotum, it is largely skin, but it does contain muscle as well, the cremasteric muscle. And you're probably aware of this muscle. It will contract. So if you're cold or if you are nervous, it will contract. You're probably also aware, you've probably come across sumo wrestlers in Japan. They actually learn to contract their cremasteric muscles so that they can protect their testes when they're going to the wrestling bouts. So it's important that it's relaxed. Get your first and second finger underneath the scrotum and underneath one of your testes, and we do it one at a time, and then just roll the testis between the two fingers and get to know what the testis feels like. So in medicine, we often refer to parts of our anatomy linked to food. And perhaps a good analogy here is a hard-boiled egg. Probably not the best analogy in the world, but it's probably as good as we can get. And so the consistency of the testis is probably somewhat akin to a hard-boiled egg. So it's firm, but it's not hard. It does yield. And hopefully, if at some point you have examined your own testis, you'll kind of identify with what I'm talking about. So it should be smooth. There is, in addition to the testis, something called the epididymis, which is a collection of coiled tubes, and clearly that isn't smooth. So you will find at the front the testis is smooth, a bit like a hard-boiled egg, and then at the rear and possibly at the top and bottom as well, you will find the epididymis. So it's important to explore, find out where the epididymis is. And they're probably the main two components. At the top of the testis, there's what we call the spermatic cord, which takes away the tube that conducts the sperm, and also contains blood vessels. So just get an idea for what it feels like. Size varies. They estimate between 15 mils and 35 mils. Everyone's going to be different. Each testis could be of a different size. Location, one testis often is lower than the other one. That's completely normal. Get a feel for, as I say, that the consistency, the shape. Are there any lumps there? Does the scrotum feel normal? Is there any evidence of any accumulation of fluid? And I think probably the big thing here is there any evidence of change? So get to know what normal is like so that you will be able to pick up abnormal at the earliest possibility. So abnormalities would include, say, a lump, change inside. That might be something getting bigger or smaller. Thinking about the shape, consistency. Also think about any symptoms that you might have. I've said already that generally speaking, changes to do with cancer are likely to be painless. Probably about 80–90% of changes are going to be painless, but you might start to feel a sensation, a kind of dragging sensation or some discomfort in the pelvic area that might alert you. Something else that might happen, and this relates to some of the tumours that can occur, is that you might find other changes elsewhere in the body, because some of them do secrete hormones. And so, for example, enlargement of your breasts might start to occur. So just be aware of what normal is like for the rest of your body. What is not likely to be a sign of cancer? You know, there's a danger here that we start to do this and we panic ourselves because A, we're not sure what normal's like, and B, we find something, we think, oh my God, this is terrible. So things like an ingrowing hair, a pimple, a rash on the scrotum, that's not likely to be linked to cancer. Finding a little bit of a free floating lump in the scrotum, particularly one that's smooth, isn't likely to be a sign of cancer. A lump on the epididymis, particularly if it's smooth, is likely to be a cyst. It is not likely to be a sign of cancer. Pain or burning when you pass urine is not likely to be a sign of cancer, because there are other conditions that you need to be aware of in addition to cancer. So you can get cysts, funnily enough, you can get varicose veins in your scrotum, and that obviously can present as a tumor. You can get what's called a hematocele. This is a blood clot normally occurring if you've had some kind of trauma or injury to the testis. You can get a condition called testicular torsion, which is where the spermatic cord, which attaches to the testis, twists and it cuts off the blood supply. That is extremely painful, and it is a medical emergency. So you will certainly know about it if you've got it, and if you have got it, you need to act quickly. You can have infection, the condition called epididymo-orchitis. This is infection of the testis or the epididymis. And occasionally you might find an undescended testis. So you might actually find, if you've not done it before, that you can only actually feel one testis, and the other one will be stuck somewhere, probably either inside the abdomen or in the space between the scrotum and the abdomen. It's important if you do find that, it's important that you do attend to it, because left on its own, that it does increase the risk of cancer in the testis, and it is associated with infertility. So that's a very, very quick run through in terms of why you need to be aware of your own anatomy, the importance of having a routine where you check yourself regularly. And if you do find something untoward, you take action promptly. Go and see your GP, get it checked out. And if your GP it confirms the fact that there's something might be amiss, you will then be referred promptly for specialist care and attention. So I should stop at that point.
Yeah, thank you, John. Thanks very much. We've got a question from Joe Carmichael, which says, would any cancerous concerns be identified by a consultant conducting a vasectomy procedure?
They might do. I think it's a long time since I've observed a vasectomy. I mean, obviously it's done as an outpatient, but I would, from memory, I think any surgeon, before they operate, they're going to examine you, because they need to know what the anatomy is like, because what they're going to do, it has to be safe. So the chances are that they will examine you, and if there is something there which is clearly untoward, they will pick that up.
Thank you, John. And one question from me. I know you're short of time and want to keep on track. What are things that men can do focusing on testicular cancer, not testicular cancer, testicular health? So what can men do to focus on that? to help themselves with.
Yeah, I mean, there's a lot written about this, and I think to some extent there are certain sort of myths floating around. So I'm not the world's expert on this, but what I would say is, I mean, your general well-being is important. But I think in terms of specific health, it's about, there's a reason that the testes are outside the abdomen. They need to be at a lower temperature. So I think there's something about the clothing that you wear, and certainly where people do have problems with infertility, people are advised to, for example, to wear boxer shorts just to make sure that the testes are not trapped against the body. Obviously, be careful in terms of any activities that might expose the testes to trauma. And obviously, I would guess a number of people listening to this talk will be involved in things like football or rugby or whatever it is. You know, wear the appropriate clothing there to protect yourself. But I think a lot of it is just common sense. I mean, in terms of the cancer, and I know this wasn't particularly about cancer, but just to make the point, whilst there are certain risk factors, there's nothing that's modifiable. So there's nothing that we can do in terms of our lifestyle that will necessarily change our risk of getting a testicular cancer.
Thank you, John, and thank you very much for your time. We need to move on to the next stage. Thank you. I know you do. So thank you, John.
Thanks. Have a good day. Bye.
Thank you. Just for everyone to be aware, this is being recorded, so that we will be sending the link out, and everyone who's participating is happy for us to record this. We're going to get our next speaker now, who is PC Naz Cowdery. Come in, Naz. Take a seat. Naz is a Hampshire officer and has kindly offered to talk to us about his experience of testicular cancer. So it's your story, and it's over to you now. So thank you very much.
Thank you.
There's water there and
sure. Lovely, thank you. So hello everyone. So my story is back in 2021. I was going through a very messy separation, all sorts of issues, stress, and I was off sick work with stress. And just it come up one day in my mind. I didn't feel quite right, so I just thought I'll check down below. I did. This was before my birthday on the 7th of December 2021, and I found that there was a lump which was quite substantial in size. Having checked it, I just thought, no, I'm going to leave it for a weekend. I'm not going to bother. And then obviously I remember there was something back when I was based at Eastleigh Police Station in Hampshire. There was on the urinals, Jason Cundy, who's many of you who know, ex-footballer, does TalkSport right now. He had a poster and it said, "Check your balls." So that was in the back of my mind. That was what triggered the initial check. And when I found this lump, but I left it for about a few days. Then I went to my GP. A few days after my birthday, had a check, and the GP said there is a lump there, substantial, and another GP came and checked, said it's a lump. That was the most painful experience ever, but now that pain was worth it. It was so painful, but they said nothing to worry about. I think it's just to give you some clarity and assure us. I'm going to book an ultrasound. So they booked an ultrasound. Check. So I went on the 15th of December 2021 to the local hospital, thinking this is just a lump but nothing untoward, and when the check was done, the operator of the ultrasound, he basically said, "I'm really sorry, you have a tumour." So that was the first part of it. That's the biggest shock of all shocks. And I said, "Does that mean I've got the big C?" And he said, "I'm afraid it's most likely yes." So I'm going to send an email now to the urologist. You get something within 2 weeks, get checked. So I left very despondent, thinking this isn't good. I looked on YouTube and obviously looked at Macmillan testicular cancer, researched it a little bit. And it said that the cure is very good for testicular cancer. It's a very high cure rate. I then looked at some other YouTube footage. Professor Chris Whitty did a talk on testicular cancer, as well as other cancers, and said that it's one of the most curable cancers. But statistically, it affects those that are mainly white males, aged between 20 to 35. And here I am in my late 40s of South Asian background. So I was really unlucky. So that got me. Anyhow, moving on forward, I went to see the urologist 2 weeks later at Portsmouth Hospital. He basically said, he confirmed it is testicular tumour and it's likely to be a cancer, so we'll book an operation. So the operation was booked in for February. And then he also booked me in for a scan, a CT scan, just to make sure that it hadn't spread anywhere. So I did the CT scan, and then I had a phone call in January. The operation was meant to be in February to remove the testis with the tumour on it. I was given a phone call saying, would you like to do an operation tomorrow? We've got a cancellation. Obviously, I said, yeah, straight away, I will have the operation. Yes, please. So the operation was booked in, and then I had it the next day, which is fantastic. But then I had the bad news. No, sorry, that was before. But before that operation, I had the bad news. I had a phone call from a urologist for my CT scan. He told me that the cancer had spread all around my tummy, through my lymph nodes, my back, up to my lung. So that was a bit of a shock. Again, I was given some reassurance, but I didn't understand. He just said, don't lose any sleep over it. It's very curable. So again, that was the reassurance I had through chemotherapy. So I was going to be seen by Dr. Brown, who's senior oncologist at Southampton Hospital. So yeah, it was complete shock to me. And then I had my operation, and the testis was taken out. I went to see the oncologist at Southampton. They told me the oncology result, as in the biopsy result, hasn't come through yet. But they said, looking at the scan results, there doesn't appear to be anything on the lung. It's quite murky, so you may not actually have cancer. So I left very happy. That was at the end of January. And I forgot to mention about the operation. Yeah, the operation was straightforward. They basically made an incision in the groin area, went inside, took out the testis that had the tumour. So in January, I had a PET scan done just to make sure that it wasn't cancer. And that was basically injecting you with blue dye to get, so the cancer cells can glue onto that and you can see it better. And I was told you will need to go and have the chemotherapy, and it will be 4 cycles of chemotherapy. But we need to come back. You need to come back and see us. So I went back to the hospital, saw the oncologist, and basically they explained to me that I've got 2 types of cancer in my tumour that they did the biopsy on. One was a seminoma and the other one was a non-seminoma. And on the non-seminoma one, I was told there's 4 different types of cells in the non-seminoma. In basic terms, out of the 4, one of them is a bad one that will come back. He said it's not that one. So one of the others, it's a germ cell one. So that was fine. I was quite happy with that. Then I had to sign a consent form for the medication. So the medication for chemotherapy was, one of them was called cisplatin, and another one was something else. Because there's 2 different types of cancers, I need 2 different types of chemotherapy treatment. And it will be over 4 cycles. But this is, to me, I've never known anything about cancer before. I've always avoided talking about it because obviously the fear of it, but always knew other people had it, but never thought I'd have it. And then I had my 4th cycle of chemotherapy. It was horrible. It was aggressive because of the because of the type of cancer it is, and it's very curable, and the prognosis on the consent form was to cure, I went ahead with it, no issues. I didn't even bother looking at the side effects. And it was probably the hardest part of my life, I would say. Physically and mentally, it really took it out of me. I was extremely sick. And each cycle was 1 week of, from Monday to Friday, 9 to 5, literally go to Southampton Hospital, get 2 different chemotherapy drugs put inside by what's it called? Intravenous.
Yeah.
And take anti-sickness tablets, take water tablets, take blood thinning injections in your tummy. So it was, and I hated needles. So yeah, going into that world, it was horrible. So I did that, but I sat next to someone on my first or second day of chemotherapy, and there was a guy next to me, and he had issues with his liver, and he was 40 something, very young, 2 kids, separated from his wife. He was staying with his mum, and he was telling me that my prognosis is longevity of life. But he was saying that you're here for a long time, aren't you? And I said, yes, I am. But my prognosis was cured, so I couldn't really tell him any more than that. I was humbled with that. So yeah, I carried on with the treatment. And by the time I got to my 4th cycle, I said, if this doesn't work, then I'm not going to take any more, because I lost all my hair. I lost weight. I was sick. I gained weight as well, because there's steroids of some of the anti-sickness drugs and other things. So it was just a mixture of all sorts going in my body. I couldn't walk. As I used to be able to run 6-7 miles, and then all of a sudden I can't even walk 200 yards after the first week, or after that week of having the medication. So it would be Monday to Friday the medication, Saturday, Sunday, Monday, Tuesday being sick, throwing up, and then the next few weeks coming back to some kind of normality, tasting food, drinking water normally again, kind of. So yeah, it beat me. So at that point.
Thanks for sharing your story. I think as a cancer survivor, talking about it can be therapeutic, but it can also be quite traumatic. So thank you very much for sharing that with us. I think a point that was really important that you made is, guess what, you're not white, and you're not between 18 and 35.
Yeah.
So whereas we know with prostate cancer, highly there's more chance of getting it if you're black Afro-Caribbean, but obviously with testicular cancer, they don't know why you're more likely to get it if you're white. So I think, it just goes to show,
Yes.
you just never know. In regards to your treatment and how bad you felt, a breaking point, what was your family support or friends network? Was support there for you?
I was very fortunate. I had close friends that took me into hospital every day, brought me back. I was in bad mood going in because I didn't want to go, but I had to. So they were good. Close family, really, really good. I needed physical support because when I was throwing up, couldn't get out of bed. I was bedridden after each of my chemotherapy treatment. So that side of it was good. Mental support I got from my work colleagues was second to none. And I have to say, organisationally as well, I think knowing that I had cancer, I didn't have to worry about the sick side of things because my Fed rep had it all covered, and updating me on a regular basis of what's going on, if anything was needed. If there's anything that was going to concern me, he would just deal with it and sort it out. So I was, for 6 months, it was painless, being off sick and just trying to recover my life, getting the treatment that I needed. So yeah, but the friends network was amazing.
There is a question here, and obviously you're not of a medical background, that says around because you get testicular cancer, are you quite likely to get prostate cancer? When they did your checks, was that a discussion they had?
The surgeon, before he put the mark on the right side of the leg where testicular was going to be taken out, he mentioned from the X-ray that you're unlikely to get. He just said this strange thing, you're unlikely to get prostate cancer. Your prostate is very healthy, from what I can see. So it's just a bit bizarre, really. I was a bit confused with that. But I would suggest if anyone had that said, still do a PSA test.
Yeah.
Which is something I need to do.
Yeah, PSA is really important.
Yeah.
You've already answered a question that Nick Bailey had asked around can an ultrascan or CT diagnose, and it did with yourself, which is great. Are there any other questions, Lee?
So the one from Maria, and this is more of a personal question in relation to your occupation.
Yeah.
Naz, is how did you feel about telling people in work, in particular your line manager, and did it make a difference to the gender of your line manager for you?
I was
Really good question, actually, really good question.
I was actually very fortunate. My line manager was a female. She's similar age to me as well, and she was my sergeant. She took it on really well, and straight away she said, the first thing she said to me was, thank you for telling me. She said, you're not coming back to work. Straight away she said, first thing she said, because you need the operation and you're not getting COVID, because that was the height of COVID still at the time.
Yeah.
So she said, I don't want you to get COVID, and if you need anything, take it. And every month, every 3 weeks to a month, she would keep in touch with a simple text message. I was very much appreciated, and she'd meet me for a coffee in between my cycles when she knew I was towards the sort of like week 3 of my first cycle, the second, so on and so forth, so that she knew that I was in mentally a better place. I could talk.
It's really positive to hear that you had some really good Fed support, and the Fed rep was there for you. That's great to hear. In regards to, someone's asked around physical pain and emotional pain. Yeah, there was a pain before. After the operation, what was that pain like? And the other point, how important and crucial was it having just that picture or that check your balls on top of a urine?
That is a game changer. It's a life changing thing, because I would never have thought about checking my balls. I would never have thought about it if I hadn't had that poster in the back of my head. Because when we work, every day we go to the toilets, wherever, we see these things, it sticks in there somewhere. It's in there somewhere in the brain. So it was important. And what was the other part of the question? Sorry, it was.
The other part was around, there was a lot of pain before, you mentioned that.
Yeah.
After that operation, that
right.
How
so
was it manageable, basically?
Yeah. So way before I even found this lump, I had sciatic pain, which maybe hid through issues that I had, because I went to see a chiropractor and all that, and it started to work, it started to go. And then when I read up on it, one of the things, if you've got back pain and it's continued for a long period of time, it could be symptoms of testicular cancer, which I didn't know about. Only until I found the lump, then I read up and found out. The pain after the operation, I didn't have any pain after the operation. It was quite painless, to be honest. The only issue I had was where they did the incision to take the testy out. It's just that wound. Other than that, no, I didn't have any pain.
Okay, and the last question, is there anything else at work? Just so you know, people can make sure they're on mute, because occasionally we're getting some noise in the background. So if everyone can make sure they're on mute, that's really helpful. It sounds like it was quite a positive experience with work, the Fed assisted.
Yeah.
How crucial was that?
It was a massive, because can you imagine? I couldn't imagine it now. Obviously, if I'm going through all the cycles of treatment and I just want to be left alone to heal from the horrible 2 sort of chemotherapy drugs that I'm taking and all the side effects of it, the last thing I want to do is think about anything going on at work. Because one of the symptoms of all, not just my chemotherapy, other chemotherapy as well, and maybe radiotherapy, is you get fuzzy brain syndrome. You forget things. You won't be able to remember very quickly. And you won't be strong enough. You'll be quite tired. You'll be sleeping. You just won't keep tabs with things. So it was so important that my Fed rep was doing all the, helping me out with the work side of things. Absolutely.
I'm really, really grateful for you sharing your stories and that cancer journey that you've had. It's fantastic that you're in good health. I think as men, we touch our balls, but do we really know them? And I guess this is an absolute opportunity to highlight that it's really important that you know your bodies, that you know your balls, and it's just really struck me that from just something in front of the urinal or in the toilet, that as police officers we see, or wherever you are in service stations, you see this. If it makes a difference to one person, which it has to, it saves a life. So really appreciate you talking to us, Naz, and thank you very much.
Thank you.
Thank you.
Thank you. Thanks.
Thanks. Our next speakers will be Ali and Paul. They're from Hampshire. They're part of a support cancer group. We just thought it'd be a great opportunity to see what support looks like as a cancer survivor. It's essential that you have support outside of your family and your friends' network. So, got about 10 minutes, and I'll start with you if I can, Ali.
Yeah. So it kind of started with Naz.
Yeah.
We all used to work together on our full-time public order team, and when we heard about his diagnosis, even though it's 1 in 2 people that get cancer, it was a shock. And then we got talking, and it turned out one of our other colleagues, his wife, had cancer, and he'd been supporting her and sort of maybe battling it a bit alone. And I'd been supporting my family with my dad, who was very ill with cancer. And then we just kind of set this informal kind of group, bit of fundraising, did some really horrendous physical challenges to just show some support for Naz and to try and spread the word. And then just as we finished all of that, really, so we did 9 months of very grueling, horrible, hard work. Another friend, Kev White, was diagnosed with cancer. So we then started chatting. We were still offering, again, very informal, just a bit of peer support for each other. And then we kind of the realization of there must be other people that need that. There must be other people that would benefit from this. And maybe it needs to be something more formal. And that's kind of really how it came about. So,
yeah. Paul?
Yeah, that's it. Just as Ali says, really, it was just that experience of seeing sort of too many friends and specifically colleagues either having a diagnosis and treatment themselves, or sadly passing away, or their family members kind of passing away, and that kind of informal support. That's how it kind of started, and the numbers just seem to be going up and up. And the more people we spoke to, the more we realised. I think the stat now, isn't it, is that 1 in 2 people will, be diagnosed during their lifetime. We just thought there's a need to do something to formalise it. So it started with the fundraising effort, and I forget the figures, but it was like a decent chunk of money. But there was 2 sides to it, really. One was actually the good work that funding is going to do to hopefully improve research and treatment, but also it was just our way of feeling like we were doing something to kind of fight back, really. As Ali said, we're a full-time public order team, so we kind of liked a bit of physical activity, and I think it was just our sort of natural response was to kind of get active and feel like we were doing something. But yeah, as we spoke to more and more people, we thought, this scope to kind of offer help to more and more people. And my biggest fear, to be honest, was and 2 particular mates, Naz and Fish, we call him, another chap on the team, who was away. Was that they already had quite a good pre-existing support network around them because they'd lived in the area and worked in the area for a long time. My biggest fear was, what if a new officer had maybe transferred into the force from outside the area, didn't have that pre-existing support network? What if they or a family member were diagnosed with cancer and didn't have that network around them, knowing how tough it was for Fish and for Naz with the support? I just kind of thought that's not a great situation to be in. So we need to get some sort of offer out there to the force. And I've got to say, I'm just a kind of admin support for Ali. Really. Ali's the driving force behind it, and it's done a great job of getting it up and running. So we're a really new group. We've only officially launched at the end of February. And we've every kind of month or week that passes, really, more and more people are coming forwards. And so there's a few sort of different things we try to do. The fundraising element continues. I know cake's not the healthiest thing in the world, but we did make a decent chunk of money.
Yeah.
Just
Everyone loves cake.
just land That's it. Signposting is a lot of it. It's kind of raising awareness. There's a lad in force called Snowy, Stuart Snow. He's done incredible work, and we're really lucky in Hampshire that our chief officer group have kind of found the funding to do regular PSA testing.
Yes.
Technically for over 50s, although I think they've dropped it to 45 now. 40 now, which is brilliant. And again, there's even more colleagues of ours, in fact, 2 of them from the same public auditing that we were on, who had got sort of positive tests and have had earlier access to treatment as a result of that. And, you know, who knows what the outcome might have been if they hadn't have been identified. So that would be my sort of key message from me, really. If there's any sort of chief officers out there who've got access to the purse strings, it's a relatively small investment for, you know, to make a phenomenal difference, to kind of potentially save lives. Or it's not potentially, it is to save lives. And also, kind of, as chief officers, it gives you a sort of healthy and motivated workforce. So that's one of the big ones. So that's it. It's fundraising, it's signposting, it's raising awareness. A big part is the buddy support group. So we've got how many now, Ali?
We've got 28 buddies in force who are willing to be at the end of the phone, signpost, listen. They've all got lived experience. So they're either cancer sort of sufferers themselves, whether they've recovered or still currently going through treatment, or it's someone like myself who's got a family member and again has had that experience. And unfortunately, bereavement, things like that do come into it. So. And
how have the force supported you in the work?
They've been really good. So I mean, we were quite lucky. There was a model that I was aware of that someone had already set up in relation to baby and miscarriage loss.
Yeah.
And I had looked at that and went, I think that model will work for us. So it was just kind of utilising that, speaking to them to go, all right, let's not make the same errors. Can we learn from any hiccups that you had along the way? But it was first off, just put it out there. We think it's a good idea. Does everyone else? So we sort of tested the water with a generic sort of email on our intranet. Is there anyone who would like to be a buddy? And like I say, we were inundated. So that told us that people felt that there was a need and they wanted to help and get involved. And then from there, it was just getting the right people and contacts, and we managed to set it up fairly quickly.
Yeah, it's not been that difficult, really. So we've got sort of chief officer group sort of sponsorship, really. They're sort of everybody behind it. I should make it clear that this is just something that all of the buddies do, Ali and myself included, as a bolt on to our day job. It tends to be like checking the email, something I do sort of at the end of the working day or the working week. Really, it's not eating into job time. So there's kind of no investment of officer time as such, other than the fact that we've got a force SharePoint page set up. So if you type cancer or cancer support group into SharePoint, our cancer support group page comes up with all the different links and signposting and sort of offers that are there. We did have a kind of cancer support group buddy day just to make sure that everyone was kind of on board with what they were signing up to, got some sort of rules of engagement agreed, because, you know, all of those buddies have had the lived experience. Some are still undergoing treatment. They're having a tough time of it. We don't want to overburden those buddies either and sort of put them into a position of supporting others when they're maybe not sort of physically or mentally resilient enough to do that. So there's kind of an opt-in, opt-out option. So yeah, there was that away day, and you know the chief officer group were fine with us having that day. And that's something we'll repeat probably every.
So Paul and Alison, fairly new in this concept, providing making a difference. How are you, or are there strategies or a framework for yourselves to be able to deal with some of that? So the trauma and the emotions of individuals. I think you may have lost them, as you said, a really close colleague in the last couple of weeks, which plays a massive part. So what is in place for the individuals? And from a fair point of view, we're really aware of caring for the carers. This is a piece of work we're doing on top of. How are you making sure that you're okay, and also your buddies and mentors are managing that as well?
As Paul said, we did a training day before we went live, and we had someone come in from Blue Light Wellbeing to talk to everyone, and again make sure that mentally, physically they're in a good place to start this process, if you like, and offer support. And it is very much being aware, as you say, of your own emotions, your own well-being, and if it's too much, there's no issues with saying I just need a bit of time out, and then when you're feeling better, you can come back to it. So it is that opt in, opt out, and it is about, we have a Teams chat, so regularly put updates and posts on there so that people can see. When we've had people so far reach out and say I'd like some support, you know, I'll put on there, has anyone who's got the capacity. It's not, you know, are you willing to take this on, or do you feel you can? It's that sort of thing. It's not a you must, you should, and let's say trying to overwork or overload people.
And I'd say none of us claim to be experts on everything we offer. In fact, none of us probably claim to be experts on anything we offer. But we've all got sort of little areas within it that we feel quite confident that we've got that knowledge of. You know, I'm a uniform inspector with my day job on a neighbourhoods team, so I've had a few line managers reach out to me to sort of just say that they've had a staff member who's been diagnosed and they're just not quite sure on, you know, what they can do as line managers to support their staff. And often that advice isn't sort of revolutionary, really. It's just kind of pointing them towards the kind of signposting available on our SharePoint page. So rather than just relying on Google, we've got some sort of trusted information for them to read through. And again, a little bit of signposting into sort of latest policy and procedure. But over and above that, kind of just giving them the confidence that as line managers and looking at our code of ethics, it's about doing, what's the tagline? It's kind of the right thing in the right way for the right reasons. And policy is, you know, the basis for that. But it's at kind of one point in someone's career, their life probably, when they need a lot of support, and just give them the confidence as line managers to do the right thing by that person at that point in time.
I think it's also a real quality is listening, that not many of us are that good at. And just to listen to someone, and listen to someone's stories really, and to give them that time is so essential. And maybe that doesn't always, you don't always want that to be around family or people that have an emotional connection. It's so important. Do you have any questions, or we've got about maybe a minute before we?
I think that's quite important to point out. We don't claim to be counsellors. We're not trying to counsel anyone who reaches out. It is about signposting, and it is about, as I found, talking to someone who understands the treatment and how awful it is actually quite, and like I say, having them listen, and they get it. Sometimes you don't even need to say it; they get it. That in itself is just wonderful, and that's kind of what people might need, is that just level of understanding. And that's what we all benefited from, and you can sort of go right, and it's that really, it is that simple and that basic.
Well, if there are no questions, just want to thank you for coming. Look forward to having a chat after. Hopefully you'll stick around, because these things make a difference to people, so please don't think it doesn't. And once again, really sorry for your loss of your colleague, and thanks very much for being here today. Thanks, Paul. Thank you.
Take care.
Great. Thanks. Our next speaker is going to be Kate Young from Flint House. Kate is a deputy manager of rehab. She's also a physiotherapist and has done some extra training around cancers, male and female. So Kate's probably going to talk about male and female. Kate, just so you're aware, there is no-go area. Please talk about whatever treatments, whatever parts of the body, because cancer respects nobody. So over to you, Kate.
Okay. Hi everyone, thanks for having me here. I'm really pleased to be involved with this today. I was just thinking as your speakers were talking there that we've had lots of female-based support groups reach out to us here at Flint House to see if there's anything that we can help to be involved with in supporting them. And this is the first time I've been involved in something that's men's health based, and I'm really delighted that this conversation is happening, and I'm really pleased to be here, so thank you for having me. I thought I'd just start by sharing a little bit, for those that don't know, about us here at Flint House. I think a lot of people are familiar with the work we do here, but just in case, we are a rehabilitation centre. We're based in Oxfordshire. We help to support serving and retired police officers from forces through the Midlands and then down through the south of England and Wales. And originally, really, the remit for us was to support officers that were going through any kind of injury or illness, to help in getting people back into their full fitness. As it's, we've kind of evolved as we've been going forward. So I think people often think of us maybe supporting people following accidents and bad backs, and of course that's what we do. But we're also here for lots of other things as well. And what I noticed a few years ago now was that we were getting more and more applications from people who had been diagnosed with cancer and had been going through their cancer treatment, and then reaching out for some help from us. So we were supporting those officers, and at the time I was thinking, I feel like we could develop this. I feel like there's probably more that we can do to help support people. So that set me off on a trail, and I discovered that there was some postgraduate training that I could do. So I'm a musculoskeletal physiotherapist in training, but I discovered that there was some postgrad courses that I could do to help support everybody. So I started off with a PINK course, which is based around general cancer for people, but also with an emphasis on breast and ovarian and gynecological cancers. So I started off doing that course. We also covered lots of other things. So there was colorectal cancers, head and neck cancers, sarcomas, blood cancers, and then a module about more advanced cancer. So I started with that, and then we started to bring that into play and use that knowledge that I'd learned to help support people better when they were coming to spend some time with us here at Flint House. And then I had a short break, and then I think it was about a year later, I then did the STEEL element, which is the male-based cancers. Now on that one, there was a number of different modules around prostate cancer to try and cover everything that we needed to learn about that, but then obviously testicular cancer as well. And then even some more training around other types of cancers that can affect people. So I was really pleased to take that on and then start to be able to offer a better service towards men who might be affected by more of the male-based cancers. And then following that, I noticed that there's other things that can come along following cancer treatment. One being lymphedema, which is where if the lymph nodes are affected or have to be removed following a cancer diagnosis, it can cause more complications. So I undertook quite a lengthy training course for that, so that I'm now qualified as a lymphedema therapist too. One of my colleagues, Lindsay, she's also now done the PINK and STEEL training, and we're also just about to start some more in-house training to help upskill some of our other physiotherapists here, because we are just noticing that we're getting more and more applications for people following cancer diagnosis and treatment. So who can we help? Lots of people reach out when they're just starting their treatment, which is great because we can talk about when might be the best time to have some support from us. So people following treatment, it could be you've just finished your treatment, it could be you finished 10 years ago, but you're still not quite sure and confident about what you're doing, or could you be doing more? So we're really happy to support people in that position. And we're also here to help people who might be living with cancer, which is another thing that can happen. So again, anybody that's been affected by cancer, has had treatment, has a current diagnosis, is living with cancer, we're very happy to help support you. So why might you need physical rehabilitation? What might that look like? What we find is that following treatment, or if people are having ongoing treatment, they can just feel a little bit left sometimes. So when the really acute episode of treatment happens, and then some people might be discharged by their oncology team, or they're on a yearly review, they feel a bit like, what now? I've had the treatment, but I don't know what's safe to do. What can I do? How do I get back to feeling more like myself? So really, we feel like we're in a good position to help start that process from moving from illness back into wellness, and kind of get people back to feeling more like themselves. The systemic effects of some treatments, so common treatments we are going to be helping with is either surgical treatment. People may have had systemic, so chemotherapy, radiotherapy, immunotherapy. There's lots of different things. Hormone therapy, that can be a big thing that can affect people following different diagnoses. So as a result of one of those, a combination of those, people might have lost strength, they might have lost mobility in certain areas of their body, they might have lost their cardiovascular fitness. Thinking more specifically to prostate cancer, we see men sometimes have continence issues, so that's something that we can help with. We like to help educate people with what's available to help with erectile dysfunction, which can also be something that happens following prostate, particularly prostate treatment. Obviously here today we're talking more about testicular cancer and checking and that side of things. So specifically to testicular cancer, when I've had people here, it's more helping them with maybe scar management, getting back into their cardiovascular exercise, building strength, core strength, because it is a lower abdominal surgery that has to happen. We can also help sometimes following systemic treatment. People get very fatigued and it's hard to know how do I move forward with this. So essentially we're here to pick up and help you move forwards wherever you might be. And there is a mental health programme that is run here separately to the physical rehabilitation programme. But what I often find when people come to spend some time with us from a physical rehabilitation is it's helpful to maybe have a one-to-one with one of our mental health practitioners, maybe to help signpost for any additional help. So that's something that's possible too whilst you're here. So how to access help via Flint House. It's really easy to apply now. It's all on the website. You click of a button and you can start the process. What we do ask for people that are coming following a cancer diagnosis is that we do need supporting documents from either your oncology team, be that the consultant or a specialist nurse, or maybe your GP is well placed for that. So that you upload those bits with your application. And then the application pops up our end and it's assessed by the clinical teams, most likely to be me, which is when you'll then get a phone call from me just to talk through what's happened with you, when's going to be the best time to offer help. I should also say that we do have the residential programmes, but we also have got the ability to support people virtually if that fits in better with what's going on. And if you're local enough, we can also see people on an outpatient basis. So there are different options. We're trying to make it accessible to everybody. So what happens when you get here is you have your first appointment with your physiotherapist, which will either likely be me or my colleague Lindsay. We talk through everything that's been going on, and then we can put together a bespoke treatment plan for your stay here, which could involve one-to-one physio with us, could be hands-on stuff, scar management, lymphedema work, whatever's necessary. We may refer you into some of the exercise classes. We might use the hydrotherapy. We have a rehabilitation gym here as well. So it's really just putting together what might work for you. And that's that. So I'm happy to answer any questions that anybody might have. I spoke with Claire before the call and said she's going to send out some information following the call. If anybody would like to get in touch with me directly, that's great. I'm really happy to answer any questions.
So Kate, it's really important. I mean, I said I've done a few on that. As men, we touch our balls, but we don't always know them, and that's really important that we take it to that next step. How is a female, or how important is it that our female colleagues play a really important part in men's health and testicular cancer? Because I think that was a really important role to encourage, to remind. What's your view on that? And also, how have male colleagues found having self as a physiotherapist, and has that been quite positive?
Yeah, so I mean, I think you're right, Zach, that generally, as a general rule of thumb, women are better about starting difficult conversations and about your own personal health. So I think women probably are in a well placed to help support their colleagues or their partners or their family, to just remind them that that's something that you need to do to look after yourself going forwards, and encourage maybe that encouraging reach out to your GP, reach out for help, or even when you've been through treatment again, to reach out for more help, for the support. Again, I think sometimes men historically might be not as good at starting the conversation, so it's kind of taking the opportunities that are there. I'm so encouraged to see your guests before who've gone out of their way to put in these support groups to help. So I think everyone's got an important part to play, but I think you're right. I think women like to talk sometimes, so I think it's probably good for them to try and encourage people and to nudge people in the right direction. And I hear what you're saying about men maybe arriving at Flint House and maybe having a female. Is that what you mean, Zach? Having a female?
And was that really positive? Because actually, I think it is. How was that for you, and how was that for the individuals?
Yeah, so I've always been just blown away by how well people receive it, and men are often happy to have those. I don't know if it's because it's in a clinical environment, and as a professional, that it feels easier to offload. I certainly have had many male patients here who have said to me, I haven't spoken about this. I haven't spoken to my family about the impact that the treatment's had on me. I haven't mentioned this. I haven't. So I haven't seen that it's been a barrier. I hope it hasn't been. But we are, like I say, we're in the process of upskilling some of our other physios, and one of our male physios is really interested in developing his skills in that area too. But it's all been positive, I think.
Thank you so much, Kate. We're gonna make sure all the links and everything is sent out to obviously everybody who's virtually attending. Thanks for your time. I'm involved with Flint House. I know what a fantastic job you all do and the care you put into it. So thank you very much for your time. Our final speaker today will be Ryan Crown from HSF. They kindly sponsored the event and have a fantastic health plan with real value. So over to you, Ryan, and thank you for changing time. It's much appreciated.
No, you're most welcome, and I just want to say it is an absolute delight to obviously sponsor this event and the content within it. I've had the pleasure of listening to a lot of the speakers today. I think everyone's probably gained quite a lot from it. So I'm really happy to be sponsoring the event. And just jumping back on what John's gone through and what an incredible story it was. Part of what we do, we're a health cash plan provider, but we're owned by a registered charity. So all of the profit that the health cash plan makes gets gift aided to that charity, and the charity gives that money away to different organisations and associations throughout the UK, Ireland and Malta. And the amount of charities that we work with, where the main messaging is just preventative, just making sure our well-being and our health is regularly checked, and having the confidence to know that actually just getting something checked, even if there isn't a problem, it just changes people's lives completely, is definitely the messaging that, you know, the Hospital Saturday Fund, who are our owners, and HSF Health Plan would want people to focus on. In terms of our plans, and I'll share my screen if I'm able to. Yeah, but perfect. We cover a number of different things within the policy, including just day-to-day things like getting your teeth checked, seeing an opticians, and then you'd just basically be sending the receipts and having the amounts sent through. I know Claire will send some information after this, so I don't want to really take away from the messaging we're trying to do today by talking about all the things that might not be relevant to today's conversation. But if we look at this category called specialist investigations, the way I would describe this category is as a life-saving category. You know, if we've got a problem and we're worried about it, we have the ability to go privately. If we've got a long waiting list, see someone privately, pay them, send them the receipt, we're going to reimburse the cost, phenomenal. And they're the sort of things that we want to be kind of making sure people are proactively going and doing. And when we talk about being proactive with healthcare, that might even be the fact that we have a big full body scan instead of just checking a particular area. I really like John's point to say, you know, no one ever gets an all clear, because unfortunately that's the case for everyone. Right, so a lot of people, what they'll do is they'll have health screenings every single year just to make sure them and their family are supported. You know, our plans cover the partner for free on the policy, they cover children for free. So people's priorities is mainly around their family. And now, you know, with what John said, you know, your healthcare is not only to do with you, it's to do with your household. So it's to do with your family. So that's something that we definitely focus in HSF. And I'm not going to go through the plan from top to bottom. Every single person from this will get an email and you can have a look over those things. What I will say is we work with a lot of the forces and a lot of the federations, but not all of them. So HSF Health Plan is a health cash plan provider, which I'm showing you at a discounted rate here. And if we're able to work with the federations, and all that needs to happen is you need to say to the guys internally, hey, I spoke to HSF Health Plan. It would be quite interested in putting this in place. Would you mind me sharing your details with Ryan so he can get in touch? That's all I need from you to be able to set it up so that you and your fellow colleagues or members can have the ability to join HSF and find a little bit more about it and join at a really low rate to be able to support your family and your household. And that's all I wanted to say, basically. So thank you very much. I will hand back, but we were delighted to sponsor what is a very important event on very important subjects.
Thank you, Ryan. Absolutely, we will be sending this out to everybody. So rest assured that will go out in the link. We come to the end of the webinar. I just hope everyone's found it worthwhile. It was really important for us as a federation, but as the men's health group, to have this and to remind people it's Testicular Cancer Month every month of the year, not just April. Men's health matters. There's a lot of work to be done in the police service and whatever organisations. We know there's people from other organisations, but we're kind of behind the curve and we can do better. This is part of it. Just want to thank you for your engagement. We will be sending out the links. We will be sending out some signposting. There was a question around PSA testing. We've used an organisation, a charity, Graham Fulford, the absolutely fantastic charity. So I don't know if it was Michael. If you ping something back, I'll pick that up with you.
It'll be on the post.
Okay, it'll be on the post. And if you want to speak to me about that, I'm more than happy as I'm the point of contact here. So on that positive note, I hope you found this beneficial. This is one of many webinars that we will be doing, and we look forward for your engagement and feedback in the future. Thank you very much. Bye.